Yeah, I'm Hope with Hope Sugar Gliders and Boutique. Hi, thanks for hopping on. Tonight's live is going to be a little bit different. I have two baby gliders in here and the mama glider in here. I'll explain more of the situation once a few more people hop on. I'm going to be showing you how to give medications to a glider. I'm going to go over the situation that I'm currently dealing with. Thank you guys so much for hopping on. If you're not already following me, please hit that follow. My name's Hope and I'm a sugar glider breeder, and I like to use my program to help educate and teach people about sugar gliders, and that includes good and bad and the in-between. So tonight we're talking about medical stuff. So if you guys are interested, I will be showing a couple Joeys, and I do have a mama glider in here, and I'll be going over some of the situation. I've got two little Joeys in here that are just about 3 weeks old, maybe a smidge younger. So if you ever go to my Book of Faces account, you'll see that account's been around for over 10 years. And that used to and still does have medical stuff that's happened. So that means when I have vet appointments, I usually document them and then go over with you guys about what that was. So my vet is very cool, and this might be a little graphic for some. If you're not into like education and like being a little graphic, I'm gonna show you guys this. And again, it's a little graphic. This is, anybody got any idea what this is? Yes, Sherry has it. Yes, they are glider teeth. Okay, so there's actually 9 teeth in here. So I'll do a little backstory, but it is time for me to give my girl's her meds. So I want to show you how I do that. Again, please don't like get grossed out or offended. This is my channel where I help people learn about gliders, and the more info I can help like share with you, if you guys ever run into a situation, then you know how to have your vet help handle it. And so that's why I like to use my program to help you guys, like a Clavamox, and it gets refrigerated. Okay, so it's really important because of how this medication works that it remains in the refrigerator. And then because of her size, essentially it's like the amount of a droplet. Okay, so she's very upset right now. She's been through a lot. She spent the day at the vet. I'll tell you some of the symptoms and her situation, and then that will help explain why I've got 2 Joeys on me. Okay, so this mama is pretty upset. Okay, and normally I would give her a treat, but I'm not going to do that tonight. Okay, so here she's really upset. She had a rough day. Okay, so she's in here. Okay, and so I'm going to just I'm going to hold her forward. Okay, and all right. Hi guys, thank you guys for like being patient with me. If you own gliders, sometime in your time frame you're going to go through this too. Okay, so I'm going to lean her forward, put the syringe in the corner of her mouth, and then just do 1 droplet. Okay, so she'll lick that down. It kind of, I think it has like a banana smell. But again, this type of medication is Clavamox drops, and it has to be refrigerated. So as soon as I'm done with this live, I'm going to put it back in the fridge. And per her prescription, she gets a drop every 12 hours. So she'll get it once in the morning, once at night. Now this is a broad spectrum antibiotic, so it helps cover like any dentals that my gliders have had over the last 10 years. The Clavamox has helped take care of it. It hasn't been any other type of medication. My girl Hattie. Okay, so she just recently pottied on herself, so her fur looks a little messy, but she's kind of stressed out. So a couple days ago, I noticed very minor things. She's got 2 babies that she's raising, which are in my shirt. And what I noticed was she was eating her food and doing stuff like just normal glider stuff, playing on the... I pay really close attention to my gliders, as does my pet sitter. So Hattie was acting completely normal, eating food, but I noticed when I went to do my nightly closing, I checked everybody, and she came to the front of the cage and her hands looked a little pale. Okay, and I know people are like, well, how do you know a sugar glider's hands look pale? Well, when you know your sugar gliders, you know they look a little off. And so when I touched her, she felt a little bit cold. And so what I did was I pulled her from the cage, and then I put her in a small cage with her and her babies. You do a once over on the body. And so you just like kind of palpate the stomach, feel down the tail, check for dehydration. And to me, she felt like she had a little bit of bloat. She didn't feel bloated, but she looked a little bloaty. And since she's nursing babies, it could be her milk production that makes her look a little bigger. And so in the cage, this is like some pointers if you think something's off with your sugar glider, okay? So you move them to a smaller cage where you can watch them more closely and be able to monitor them. And then also, she ate really good through the night, took care of the kids, but the next morning I noticed there wasn't very much poo at the bottom of her cage. So that was a first sensor to me of, okay, I need to watch the poo. So I checked her belly again, didn't feel like any blockages or anything. And then, I said, if things don't change, I'll have to get her to the vet. Okay. So I ended up, the next morning, checked her. She had a nice big poo. And I'm sorry for talking about poo, but again, this page is for education. And so please be kind. So she had a nice big poo, which is kind of bigger than normal, but she pooed. So that told me there was no constipation going on. And she was still nursing the babies, but she still felt a little cold. So I made the decision that I was going to take her to the vet today. Okay. So right away this morning, I was up at 7, getting everybody ready, got to the vet, and we sat and waited for appointment because there was no appointments. So when the vet came in, everybody knows my vet is Dr. Chatton from Live Oak South. He's like, I always tell people he's like my homie, but that's because like when it comes to sugar gliders, he's like my buddy. You know, he learns with me, and that's the beauty of us is we learn together. Okay. And so she's still a little more on the cool side, okay? And so he was checking her over. To me, her feet look a little pale, okay? They're a little more white looking. And then her body feels a little chilly, okay? And so so we were like going over what I felt the symptoms were. I said, I've checked her for bloat. I've checked her poo was kind of big, but she's still pooing. And so we decided, I'm like, my gut feeling says we need to check dental. Now, some of the signs of dental, okay? And again, I know this is different tonight, so please, oh, that's so sweet of you. That's sweet, thank you. So some of the signs of dental, more basic signs of dental is watching a glider eat, and they like open their mouth, and it's like uncomfortable. Like their whole, like everything changes. Or 2, they bite into something, and they kind of throw it, and they shake their head because it's like a pain that hurts. Another thing is their underbelly turns like a brownish yellow, and it's because the bacteria from their teeth and the issues with the teeth, it forms a bacteria, and when they groom themselves on their belly, it leaves like a mess on their stomach. Okay, so for her, she didn't have those symptoms. She was eating fine. Everything was fine except she looked a little pale to me, and she felt a little cold. So if you look at her fur, other than her husband marking her up a little bit, there was no fur issues. So I'm going to try and move her around. She's kind of spicy right now, okay? Just so you can see how monster size her poos are. So that, again, was, there was something where she didn't back up, but her poos were kind of sitting there longer than normal poos. Okay, but she's pooing, so we know it's not constipated. I'm going to show you her belly, okay? So again, education. I know I lose people. But, so she pee-peed on herself, so she looks a little more yellow. So she's got a little bit of yellowing. Let me see if I can show you. A little bit of yellowing on her stomach, but that's not uncommon if a husband's marking her up. It's not wet, it's just more yellow tinted. And it's not like goopy or anything weird. Now, most dental, yes, you can own them in Kentucky. Most dental, it turns out to be like a brownish yellow, and it's kind of goopy and like looks like it's wet. Hers wasn't like that. And so when I was talking with Dr. Chatton, I said, well, if you, because we had decided she was being put under. I'm like, if you don't see anything with the bloat or with constipation, then please check dental, because that's my gut instinct was saying dental, even though she didn't have typical signs of dental. And so what he did was he put her under, and it turned out she had 9 teeth taken out. Okay, and since Dr. Chatton knows my channel's used for education, he did save the teeth for me, so I'll do pictures of what the teeth look like. And then he took pictures so that way you guys can learn from what my situations are. Okay, so now that he did a cleaning, he popped out the bad teeth. The Joeys ended up getting cold during that process because they weren't able to nurse off a mom, so their body temperatures dropped. So now I'm having to step in and help with the Joeys while mom is trying to recover from the dental extractions. She's going to be on the Clavamox for 10 days. Now within the next 2 days, she should start to feel better. She didn't have any issues with eating before, but now that the teeth are actually extracted, because they're open, it's like open wounds, she may have a little bit of trouble eating. She did not, sadly, she did not want to take her body or her babies back. I believe gliders have about 40 teeth. So she lost a big chunk of them in one setting. And even my vet was kind of like, she's not showing the normal signs for dental, but I sometimes think that's the strength. She's a mom and she's doing everything she can to take care of her babies. So that means she's hiding her illness to take care of her kids. And so if we hadn't caught it in the next few days, because her temperature was off, there's a chance her and the babies would not have made it. So again, if you sense anything is off with your gliders, it's really important to separate from the rest of the gliders and watch them, watch for the symptoms, and get to the vet. So how it worked with anesthesia is most people don't know, but gliders do throw up often during anesthesia. My vet says it's like 1 in every 3 throws up. So when they're put under, it's a very quick process. Her Joeys are only about 3 weeks old, and so they're still young. And so when they're put under, they can only do it for a certain amount of time before they have to bring them back. So her procedure took a long time because they had to keep putting her under and then pulling her back out until they were able to get all the teeth out. And so mom is just about 4 years old. So this is kind of young to have dental issues. This is the first dental issue or any issue she's ever had. And so I have made the decision to not have her. I mean, she could still hold fertilized eggs in stasis, but I'm not going to be putting her back with an intact male. I'm going to give her a chance to let her body recoup, and then I'm going to retire her early. So I've made the decision. For me, my program is based on health. And if my mama, which my mama is not feeling good, I don't want her. She's a baby stacker. And sounds really weird, but what a baby stacker is it's a mom who loves babies so much that she literally stacks them. So by the time she's done raising 2 babies, she's already got 2 more almost out of pouch. She loves babies that much. But because she hides illness, I don't want that extra pressure on her to do that. And so she could continue to put Joeys in pouch for up to a year, but I have made the decision to let her retire early. The health of my mamas comes first before the babies. And I love the babies. Like I said, I'm jumping in and taking care of them. But if it's going to be hard on her body, or it's just, if a health issue comes up, it's my sign to retire them. And so I would rather her get through her health, get her health back on track, and then not have to focus on babies. She loves babies. I don't know how she'll handle it. And I'll continue to update you as we all go. Like if she puts 2 more Joeys in pouch, I'll let you guys know. So that way you guys can learn too.